Hello everyone. Today, we're diving into the world of a medication called Glyburide, which is also known by its brand names Diabeta and Micronase. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Glyburide, also marketed under the brand names Diabeta and Micronase, is an oral medication that falls under the category of sulfonylureas. Its primary function is to help control blood sugar levels in individuals with type 2 diabetes. Glyburide works by stimulating the release of insulin from the pancreas, which helps lower blood sugar levels. It is usually prescribed in combination with diet and exercise to improve blood sugar control. Glyburide was approved by the FDA and has been a staple in diabetes management for many years. It's not typically used for type 1 diabetes or diabetic ketoacidosis, as it requires some insulin production from the pancreas to be effective. Warnings: Glyburide comes with its set of precautions. It is not intended for individuals with type 1 diabetes or those experiencing diabetic ketoacidosis. People with severe kidney or liver disease should also exercise caution, as these conditions can affect the medication's metabolism and excretion. Glyburide can cause hypoglycemia, low blood sugar, especially if you miss a meal, exercise too intensely, or drink alcohol. Symptoms of hypoglycemia include dizziness, sweating, confusion, and shaking. It is important to recognize these symptoms and treat low blood sugar promptly. Before taking this medicine. Before starting Glyburide, several factors need consideration. Inform your healthcare provider if you are allergic to sulfa drugs, as Glyburide is a sulfonylurea. Discuss any existing medical conditions, especially kidney or liver disease, adrenal or pituitary gland problems, heart disease, or if you have ever had an enzyme deficiency called glucose 6-phosphate dehydrogenase (G6PD) deficiency. If you are pregnant, planning a pregnancy, or breastfeeding, consult with your healthcare provider as Glyburide may not be recommended, and alternative treatments might be preferred. Regular monitoring of blood sugar levels is crucial for those taking Glyburide. You should not take Glyburide if you are allergic to it or if you have type 1 diabetes or diabetic ketoacidosis. It's essential to let your healthcare provider know if you are taking any other medications, as Glyburide can interact with various drugs, potentially altering its effectiveness or increasing the risk of side effects. Side effects: all medications can have side effects, and Glyburide is no exception. Common side effects include nausea, heartburn, feeling full, and weight gain. More serious side effects can include hypoglycemia, jaundice, yellowing of the skin or eyes, dark urine, and unusual bleeding or bruising. Rarely, Glyburide can cause a serious allergic reaction characterized by rash, itching/swelling, severe dizziness, and trouble breathing. If you experience any of these symptoms, seek medical attention immediately. Additionally, there's a risk of low blood sugar, particularly if Glyburide is taken with other diabetes medications, insulin, or if meals are missed. Symptoms of low blood sugar include sweating, shaking, dizziness, hunger, fast heartbeat, and blurred vision. It's important to carry glucose tablets or a quick source of sugar in case of low blood sugar episodes. Interactions: Glyburide might interact with other medications. It's crucial to inform your doctor about all medications, supplements, and herbal products you're currently taking. Certain drugs can increase the risk of hypoglycemia when taken with Glyburide, such as beta blockers, ACE inhibitors, and aspirin. On the other hand, some medications might reduce the effectiveness of Glyburide, including certain diuretics, corticosteroids, and thyroid medications. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Glyburide. The usual starting dose for adults with type 2 diabetes is 2.5 to 5 mg once daily, taken with breakfast or the first main meal. Depending on how you respond to the medication and based on your doctor's advice, the dose may be adjusted. The maximum recommended dose is 20 mg per day. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. Never alter your dosage without consulting your healthcare provider. Avoid: while on Glyburide, it is advisable to avoid alcohol as it can increase the risk of hypoglycemia. It's also important to avoid skipping meals, as this can lead to low blood sugar. Be cautious with strenuous exercise, as it can also lower blood sugar levels. Always carry a source of fast-acting sugar to treat hypoglycemia and be mindful of the signs and symptoms of low blood sugar. FAQ. Many wonder about the age restrictions for Glyburide. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Glyburide. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.